Hello, everyone, and welcome to today's session, Preparing for a Kidney Transplant from Referral through the Waitlist. My name is Shayla Harris, and I'm the Director of Administration at the American Kidney Fund, a 16-year kidney transplant recipient and your moderator today. We hope you find today's conversation helpful, whether you're thinking about a kidney transplant, going through the evaluation process, currently on the waitlist, or even if you're a family member or caregiver. Now, the pre-transplant process can feel overwhelming, confusing, and emotional. So if you feel that way, you're not alone, and we're here and hope that today's session will help you better understand what to expect and how to prepare. Now, today you'll hear from two members of the transplant care team, a nephrologist and a transplant social worker, who will give us an overview of what happens before a transplant, from medical evaluation to emotional and financial preparation. Now, about our speakers today. Dr. Priti Uram is a board-certified nephrologist and professor of medicine at the University of Missouri, Columbia, where she serves as the medical director of the Kidney Transplant Program and Kidney Disease Echo lead for the Missouri Telehealth Network. She also practices at the Harry S. Truman Veterans Administration Hospital. She's the president-elect for the National Forum of ESRD Network and is the chair of its Medical Advisory Council. Dr. Uram is a recognized leader in the kidney care advocacy and education and is passionate about education and mentorship, training medical students, residents, nephrology fellows, and empowering rural providers in managing kidney disease. Our next speaker is Samika Berry. She is a transplant social worker with the MUSC Health Transplant Program, Mid-Carolinas in Lancaster, South Carolina, where she has served for 4 years. She is also the Director of Finance and co-founder of the South Carolina Transplant Foundation. She is a licensed independent social worker, clinical practice practitioner, and certified clinical transplant social worker. With more than 20 years of experience, including 10 years in dialysis, she has supported patients across the full dialysis to transplant continuum. So I'd like to thank them both for being here today. Now, before we get started, I want to let our attendees know that there'll be a time for Q&A toward the end of our session. So you can drop those questions into the chat box anytime, and we'll do our best to answer as many questions as we can. Now, let's get started with the overview of the pre-transplant process. By Dr. Uram, who will walk us through how transplant referral, evaluation, and the waitlist work. Dr. Uram?
Thank you, Shayla. I'm really excited to talk about this topic. It is something that I'm really passionate about, and I really believe that patient education and empowerment is really important in terms of getting through the transplant process. So these are my disclosures. And the outline of the talk is here. So I will take some time talking about why we should be transplanting patients, what disparities there are in the transplantation arena in terms of, who's being listed, who's getting transplanted, and some things that are being done to fight that. And finally, I'll spend a big chunk of time on the evaluation process itself. So kidney transplantation is considered the gold standard for treatment of kidney failure. And the reason for that is that we know that transplant improves survival, it improves quality of life, and it also lowers cost to the healthcare system. So that's the reason we want all of our patients with kidney failure to get transplanted. And we should make sure that our patients do have equitable and easy access to the transplant. But we know that there is a huge gap in terms of how many patients have end-stage renal disease, how many patients are starting dialysis each year, and how many patients are actually getting transplanted. So this graph shows the big gap between patients that are being added to the dialysis population and how many patients are actually getting transplanted. So if you look at the statistics, only 15% of the patients that are starting dialysis are either transplanted or waitlisted within 1 year of diagnosis. So that's a huge gap that we need to close. And what about disparities? So as I mentioned, there are lots of disparities, and these can show up in different forms. It can happen during the referral process, the waitlisting process, the transplant itself. And there are a lot of other demographic factors like age, race and ethnicity, blood group, and sensitization status that will also affect who is getting transplanted, how long somebody is waiting, and things like that. So some more information on the disparities when it comes to demographics. We know that Native Hawaiian and Pacific Islander patients have the lowest percentage of transplantation, followed closely by Native American and Black patients. And this is based on the USRDS data. Transplant rates also decrease with increasing age. So as a patient gets older, they are going to have less likelihood of being able to get the transplant. We also know that if a patient has diabetes and hypertension, they tend to have lower rates of transplant compared to some other etiologies, for example, like polycystic kidney disease, glomerulonephritis, etc. We also know that the geographic location of a waitlisted candidate really impacts the wait time. So in the recent iteration of the allocation system, some changes were made to allow for this disparity to be corrected. And we also know that some blood groups do wait for a longer period of time to get transplant. For example, blood groups B and O have the longest wait. So let's move on to what kind of kidney transplants are available for patients. So there are two major kinds of transplants. So deceased donor or cadaveric transplant. So these patients are at end of life. For example, somebody may be in a motor vehicle accident or some other catastrophic medical event. And then, they can either become brain dead, so their brain is no longer functioning, and the family has decided to donate their organs. So those are the brain dead donors that come from the cadaveric patients. And also there is a donation of cardiac death. So these patients are not brain dead, but their heart would be wait for the heart to stop, and then the organs are donated at that point. So both of these fall under the deceased donor or cadaveric donor. And the other type of transplant is a living donor. So somebody that is alive, healthy, could be related or unrelated. So they don't have to be related to the patient at all. And we also have seen that we can do lots of, donation chains, paired exchange, where if somebody is not a match for a particular patient, then we can do kidney swaps or start a chain where one patient's donor donates to the another recipient, and we continue the chain. So we can get a lot of transplants done through that process. So let's talk about who can be eligible for a kidney transplant. So one of the main criteria is that the GFR, which is, you may be familiar with something like the percentage when people talk about, oh, my kidney function is like 20%, 30%. So that's the GFR, which is the glomerular filtration rate. So that's kind of the in simplistic terms, like the percentage of the kidney function that a patient has. So the GFR has to be at or below 20 ml per minute for a patient to be able to get on the wait list. And we also have to make sure that the kidney failure is not from an acute injury. In other words, we have to make sure that this is not a reversible kind of kidney failure, because in that case, it is not appropriate for a patient to get kidney transplant. We also want to make sure that the patient meets medical, surgical, and psychosocial criteria. And I know Samika is going to talk about the psychosocial criteria in her slides down the line. So let's get to the evaluation process. So this kind of sums up the really complicated and the intense transplant evaluation process a patient has to go through as they embark on this, the whole endeavor, right? So you see that there are multiple steps, there is multiple testing that is done, you're meeting with so many different kinds of providers, there is a mound of paperwork, a lot of red tape, and eventually, if you are successfully able to navigate this whole maze, then you get on the wait list, right? So this can be quite, intimidating process. So let's look at who's on the transplant team. So we have, it really takes a village to make a transplant happen and for a transplant to be successful. So there are multiple members that make this happen. So the transplant coordinator is the main guide for a patient. So these are the people that are in touch with you all the time. They are telling you where to show up for what test. They are going to give you information about what stage of the process you are in, if you have any questions or if you want to notify anything. So they are your contact person, the main liaison, in other words. So then the social worker is there to provide emotional support, practical needs, be it like, arranging rides or looking at sometimes, insurance stuff. All of that is handled by the social worker. The financial coordinator will give you a rundown of the insurance and costs, and usually they meet at the beginning of the transplant process and kind of guide you as you're getting waitlisted. The dietitian is able to help you with healthy eating plans before and after transplant, because that's going to be vital in maintaining the transplant and prevent any major medical issues popping up, like diabetes, controlling those and preventing those from happening. And transplant nephrologist is somebody like myself. So we are the medical kidney transplant physicians. We will usually do the evaluations before the transplant, but we are also the main people that are, kind of holding your hand and, just navigating through this process. And we develop really long-term relationships, and that is one of the most satisfying things for me as a transplant physician. And the transplant surgeon is the one that provides, surgical expertise. They perform the surgery, deal with any complications afterwards. So what are the steps in the evaluation process? We know that the first step is to make a referral, and this can happen either as a self-referral or can come from a physician or a mid-level provider, and anybody that is able to provide a referral can do that, or the patient can also self-refer. So then there is usually a phone interview. Then we arrange a first visit to meet the whole transplant team. There is a testing phase where we develop a personalized testing plan, because not everybody, there are certain standard tests that everybody gets, but there are certain specific tests that a patient might need based on their medical history and other factors. Then based on all the results we have, we review as a team, and then we make a decision whether it's appropriate for a patient to be added to the wait list or not. And once a patient is added to the wait list, essentially we wait for a kidney to become available that would be appropriate for them. So this is another schematic showing the transplant evaluation process with the various steps listed. And I have an X, listed between all those steps, because there are all these barriers that can happen. The transplant process can get bogged down at any of these steps, right? So if you make a referral to the patient and then the next step doesn't happen, so there are lots of reasons a patient can get bogged down in this process and does not eventually get transplant waitlisted. And one of the major things, there is a big X between the first and the second step, because there is a lot of I would say delay in terms of like patients getting referred for a transplant, because that's not even something that is being discussed with a patient, for example, because the patient does not even is aware that a transplant is an option. They are probably just thinking that my only option is dialysis, and that's not the case. So it is really, really important for us to make sure that the patient is educated, they're aware that there is a better option for them beyond dialysis. And the dialysis can perhaps be and has to be used as a bridge to transplant, but there is a process to get through that evaluation process and get listed. There is obviously the case that the patient may not be a candidate for transplant, but it is important for them to be aware of that. So let's talk a little bit about getting started and meeting the team. So I mentioned this already, that kidney doctor refers you, or it can be a self-referral. Somebody from the transplant team will talk to you about the phone on the phone about getting some preliminary information about your health. They do send some information in the mail. That's it. Yeah, most of the programs will do that, or they'll make it available to you online if somebody is able to access the online information. Then when we bring the patient to the clinic and we meet, and they meet with the multiple team members. So it's usually at least a half-day process because you're going to be meeting a lot of people. So it can be a long day for patients. And then we also request medical records to become available prior to that first visit. So we have some records to review ahead of time. So the next step is the testing and decision. So once we have met with the patient, then we create a personalized testing plan. If there is a need for specialist referrals, depending on patients' specific medical issues or other factors, we would do those. And then the team reviews all the results together, and then we decide, can the patient be added to the wait list? If we say yes, the patient can be added to the wait list, then you have to be aware that there are two different statuses, meaning you can either be active on the wait list, you can be added to the wait list and active. So that would mean that you're actually ready to get a kidney when the kidney becomes available. Or we can add you to the wait list as inactive, meaning you're added to the wait list, you're accumulating time, but you're not ready for a transplant. And that could be for any number of reasons. For example, maybe somebody's waiting for dental work to be completed, or maybe they're waiting for a colonoscopy to be completed, or a patient is too healthy. Maybe they don't have any symptoms of needing dialysis and they're not ready for a transplant yet. So those are all the reasons that could be why somebody is listed on the wait list as inactive. So let's look at some specific tests that we do. So checking on the heart health is an important part of the evaluation process. So everybody essentially gets an EKG, echo, stress test. Again, it depends on whether they have the risk factors for it or somebody's been on dialysis for a long time. Chest X-rays is done pretty much on everyone. And you may have to see a heart doctor if you have had heart problems. And there could be other testing like a cardiac catheterization, angiogram, something like that if you do have a lot of risk factors for heart disease. We also want to check your blood vessels and blood flow because when the surgeon tries to hook up a kidney, we want to make sure that the kidney gets enough blood flow. So we look for any kind of blockages. So we do a CT scan of the abdomen to make sure that there is enough room for the kidney as well as enough blood flow to the kidney. If not, we may have to refer you to the vascular surgeon. We also look for blood flow in the carotids to make sure that there are not blockages that could cause a stroke or something as a patient is going through surgery. And then, so essentially we want to make sure that we are setting you up for success and that we are making sure that you have the right anatomy for the kidney to work properly. We also want to make sure that we are screening you for infection because one of the major things that we do after we transplant you is we put
Sure. Hello, everyone. We're having a few technical difficulties, but we will get back to Dr. Urim once we can figure those out. Real quick, please remember to add any questions for our speakers in the chat box for our Q&A portion. But now we will move forward to transition to our second speaker, Samika Berry, who will dive into preparing for transplant.
And these are Dr. Urim's slides. Okay, thanks. I'm Samika Berry. Thank you so much for the opportunity to be here. We're going to talk about how to navigate this transplant journey. And my disclosures, as Shayla mentioned before, I am a transplant social worker. I serve on a board of a nonprofit, and I'm also on the medical advisory board for another nonprofit. So preparing for the transplant, a lot of really great opportunities here to be prepared. And when you talk about preparation, we're talking about financial planning, resources that are available, medications that you're going to need to take for a lifetime after that transplant, and then appointments after the transplant. We're also going to talk about navigating your emotional well-being and how to solicit support from your family and friends during this process. And we're also going to talk about how to communicate with your transplant team, how to ask questions, and how to advocate for yourself. So a lot of really good information from Dr. Urim and from this presentation as well. So the first thing we're going to talk about is just knowing the financial information in terms of insurance premiums, deductibles, and copays. Insurance can be very complicated, so this is going to be a very high-level overview, but you're going to have a full team of professionals between social workers and financial coordinators at your transplant center. So if you're ever confused or have any questions, please make sure you reach out to them. You're also going to need to prepare for prescription copays. Like we talked about, you're going to be on transplant medication for a lifetime after that transplant. So there are going to be copays associated with that. Some expenses people may not think about will be traveling back and forth to the transplant center, lodging, hotel expenses, food while you're in the hotel, and then parking. And I'm in South Carolina, so there are 3 transplant centers in my state, but we have patients that come out of state. So they may be 6 hours away. So those patients, we need to plan for a hotel, plan for food while they're in the hotel. that sort of thing. So you always want to make sure that if you're going to be traveling a great distance, you talk with the transplant program to make sure that you have a list of hotels in advance and try to plan for that hotel. Does the hotel have a kitchenette? Does it have a micro fridge? That sort of thing. Time off work for you and your caregiver. This is going to be very important to make sure that that is discussed with the employers prior to the transplant program process, because it's going to be little to no notice when you get that call. Oftentimes it's 2 o'clock in the morning, and you want to make sure that your employer has already understood that this is something that is going to be happening. If you are working or your caregiver's working, you may qualify for the Family Medical Leave Act, FMLA. That's going to protect time off work. You also want to make sure you have sick leave and vacation leave as well. So even though you're going to have that protected time off work, you want to make sure that you're going to get paid during that time also. And depending on the transplant center, they may have a certain specific savings goal for you. So they'll make sure they go over that process. But if you have any questions, you can always ask your transplant team about that. Again, there are different ways to have coverage for a transplant. We talked about working, so your employer coverage. You could be employed, your spouse or parents, you could use that insurance. If you have kidney disease and you have a work history, you may qualify for Medicare or a Medicare Advantage plan, and that's available if you start dialysis or if you have a kidney transplant. If you're disabled, having started dialysis or having a kidney transplant and you're low income, you may qualify for Medicaid in your state. So that's another opportunity for you. Prescription coverage is also available, and you want to make sure that you are aware of the resources that come with having kidney disease. For example, Medicare and disability coverage, you have it while you're on dialysis, but those plans may actually end after a transplant. So that's something that you want to be aware of if your disabled condition is only related to your kidney disease. And again, always talk with your transplant social worker or financial coordinator if you have specific questions. And if you lose insurance coverage at any time on that continuum, if you're in the referral process, if you're on the wait list, or even after the transplant, please reach out right away. There are some amazing programs out there that can help. Medicare, there are two different types of Medicare. You can have your traditional Medicare. When you talk about Part A, that's hospital insurance. Part B is everything but hospital. So that's dialysis, going to your doctor's appointments. Part D, think about D as in drugs, prescription drugs. So you need prescription coverage as well. Then you have Part C. Part C would be your Medicare Advantage plans. And that generally encompasses Part A and B, and sometimes Part D. You want to make sure with that specific plan. And also remember, plans vary from state to state, so different rules may apply based on where you live. But the most important thing is before you make any changes to your insurance coverage, that you know that your transplant centers in network, your dialysis centers in network, all of your medical professionals are in network. That's going to be really important. Medications after transplant, you're going to take your medications for a lifetime. So have a good system of how you're going to do that. A lot of people do pill boxes. I recommend having an alarm in your phone. Everyone has a smartphone. I set an alarm on my phone one time to go off every single day to help me to remember to take my medication. So that's going to be important. Cost varies between insurance plans. So at the beginning of the year, you may have to meet your deductible again, but at any time that you have any issues with your prescription coverage or obtaining medications, please make sure you let the transplant center know help is available. And it's going to be important to stay on track for your important appointments. Dr. Uren was talking about all the red tape. So everyone uses a smartphone and calendars, but I am old school. I like a physical calendar so you can write down your appointments and dates. And that's going to be very important, especially if you're working with multiple transplant centers. There are going to be multiple testing, multiple appointments. So you want to make sure that you're prepared and you do not miss any of those appointments, because if you miss those appointments, that could cause a delay. And when delays happen, that could delay you getting to the endpoint, which is getting waitlisted to hopefully get a kidney transplant. There are a lot of medical records out there now, medical systems like MyChart that may be available. So I strongly encourage you to sign up for MyChart if your transplant center has that. I also encourage you to be multi-listed with multiple different transplant centers. So you want to be on MyChart for all of your transplant programs. But again, if you're ever unsure, if you need more information, make sure you reach out to the team. So navigating your emotional well-being is as important as navigating and taking care of your physical well-being. Like Dr. Urim talked about, this is an overwhelming process, and it is very common for patients to feel anxiety and depression. So we want to make sure that you feel supported at every step along the way. Sometimes when patients actually have the transplant, they may experience survivor's guilt or remorse. And that comes with feeling guilty because you had a transplant knowing that someone passed away. But remember, that was a very loving and courageous gift that someone decided to give and their family decided to give. So if you ever have the opportunity to write that donor family and thank them for that gift, please do that. I know that they will be so encouraged to hear how you're doing and how well you're doing. So keep that in mind. And if there's a way that you can honor that donor, be creative. I think that's also something that will help you with those feelings as well. So again, your emotional health is as important as your physical health. So make sure you're taking control of that. Also, I like to encourage people to join a support group. It is so healing to connect with other people who've also been through this process, who are going through this process. So that's going to be very important. Your transplant center will have a list of support groups. There are support groups all over the country, and with technology now, just like we're doing today, you can be virtual and online with a support group. So that's going to be very important. You can always talk to a counselor, therapist, social worker if you're having those feelings of depression or anxiety. Lean on your family and friends and your caregivers. A lot of times patients want to help, the caregivers want to help, but they don't know exactly how they should help. So let them know what support you need. Be active. Whatever you do, get outside, get some vitamin D, exercise, consider creating a new hobby. That's something that is going to help you kind of get through this process. It's more of a hurry up and wait type of thing. So you want to make sure you have a healthy, active lifestyle outside of just waiting by the phone on that kidney transplant call. And again, let your kidney transplant team know if you have any difficulties, if you're struggling, or if you need support, because support is available. And if you're feeling overwhelmed, stuck, or discouraged, make sure you let someone know. There are many resources out there. And if you're in emotional distress or crisis, I want to make sure that you know that 988 is a resource that's available. There is help. There is hope. And you want to communicate and advocate for yourself. Be prepared, like we talked about. Have that calendar ready. Have that list of questions before you go to the appointment. Everyone thinks of 10 questions as soon as the appointment's over, but you want to have that list ready before your appointment. You want a caregiver to go with you during your appointments as well, because sometimes when you're talking with that physician and then after the appointment, if you have that caregiver with you, they may have picked up on something that you did not. So it's always important to have a caregiver with you at all of your appointments. You want to make sure that you ask them to stop and slow down and explain things in simple terms if you did not understand something. This is your time to connect and make sure that you're understanding the process. And it is our role to make sure that we explain things in a way that's helpful for you. So let us know if we can re-explain any information or give you some more detail. You want to make sure that you're following through on tests and paperwork, because again, that's helping you get through that process. And if you have any questions needing emotional or financial assistance, reach out and make sure the team is aware of that. So there are very practical tips that I, in my 4 years with transplant and 10 years of dialysis, I've come up with to help with this process. The first one is very simple. Make sure your voicemail is set up and not full. I call patients every single day and their voicemail is not set up or it is full. So please make sure that you have your phone set up so that you can connect with the transplant team and they're able to leave you messages. I know there's spam calls, but you want to answer calls from unknown numbers, because that could be that transplant team at 2 o'clock in the morning saying, hey, we have a kidney for you. You want to check your messages daily. And if you have any changes in your address or your phone number, please make sure you let the team know. And again, my chart is invaluable. So please make sure that you're connected with those systems. Key takeaways, if you remember anything from this presentation, make sure that you have a support net group, plan for transplant expenses, keep insurance and prescription information active, stay organized, keep up with your appointments, support your emotional well-being, join a support group, and if things get complicated or confusing, please reach out and let us know. That is what the transplant team is for, is to make sure that you have support. Thank you.
Awesome. Thank you, Samika. We will now go back to Dr. Urim to continue the overview of the pre-transplant process.
Thank you, Shayla. As I was saying, the transplant process is complicated, but who knew, right? Technology is even more complicated. So, are my slides back up or? Okay, perfect. I think we may want to go one slide back. We're looking at infection, I believe. Okay, I got it. Okay. So I think this is where we left off after the, looking at vessels to make sure there is adequate flow for the kidney to go in. We also want to make sure that we are screening for infections because we are going to give all our patients anti-rejection medications. So these are the medications that make your immune system weak. So we want to be mindful of that. And so we screen for infections ahead of time. That is also the reason we recommend that patients be vaccinated ahead of time so they're protected from preventable infections. We also want to make sure that patients are up to date with their cancer screening. Again, the anti-rejection medications are well known to increase cancer risk, accelerate cancer growth. So we want to look for all of those things ahead of time. So anything that is age appropriate, if you are a female, based on your age, you may need mammograms, colonoscopies, pap smears. Men will need prostate check. As I said, the colonoscopy will depend on the age, the risk factors, and all of that. And if somebody has a previous history of cancer, we want to make sure that, that they are cancer-free. So we would be getting clearance from their cancer doctors. And most of the cancers may have 2 to 5 years of wait after they go into remission. There may be some additional testing that is needed if there is history of any bleeding or blood disorders or clotting disorders, because we don't want the kidney to clot off, the blood flow to clot off. So all of those things will be tested ahead of time. If somebody has polycystic kidney disease, we may have to do a brain scan to make sure that they don't have aneurysms. In patients that have hepatitis or any liver concerns, we may have to do additional workup. Like it could be an ultrasound of the liver. They may have to go see a liver doctor. So these are extra tests that will depend upon what we find along the way. If somebody has COPD or any other lung problems or nodules, we may have the patient see a pulmonary specialist, a lung specialist. And again, it's important to note that when we are doing a transplant surgery, patients will go under general anesthesia, so they'll go on the ventilator. So we want to make sure that we are able to get the ventilator off after surgery. So the patient should have a good lung capacity to be able to tolerate this. And some centers will require some drug testing. It could be random tests, and some, it may be nicotine testing, marijuana, or other tests. And it's not universal, but it just depends upon the particular center. And Samika has spent a lot of time discussing this already, but this is an important part of the evaluation as well, because this is an intense process, as Samika has already mentioned, and as you have seen through all these slides. So there is a lot going on through the evaluation process. So you need a lot of support. You need to be organized. You want to make sure that you have all the resources available to make this successful. It is also important that you have stable mental health if there is a history of mental health illness or any kind of psychiatric issues, because we do see from time to time that while we want the best outcomes for all our patients, sometimes things happen that we do not anticipate. It may be the kidney fails right after, or they may have a lot of surgical complications, and it can be a very stressful period. So we do see that when patients are going through that process, they are also under the influence of heavy steroid use. So because we do give patients high dose of steroids for the transplant surgery, they can have a lot of mood changes, and especially if they feel like things are not going their way. We have seen patients have a really big mental health breakdown. So it is important to make sure that all of this is, stable. Patients are taking their medications ahead of time, and there are some patients that will require psychiatry clearance ahead of the transplant waitlisting process. While we want most of our patients to get transplanted, it is also important to know that transplant may not be right for everyone, right? Because the whole point of giving a transplant or getting somebody transplanted is making their life better than they already have. But if along the process, if you are taking a big risk and causing issues, be it surgical complications or something even worse as death, we are really not doing our patients any favors. So we also have to tell our patients from time to time that this is not the right thing for you, or this is not safe for you. And that may be disappointing for patients, but that is the right thing to do in that setting. But it is also important to keep in mind that, there may be reasons that something may not be right in terms of the transplant happening at that time, but some of these can be fixed, right? These can be temporary problems. For example, if a patient is dealing with an active infection, we can treat the infection, and that will make them a candidate for transplant. If they have an active cancer, as I said, they could be, they could go into remission. They could wait for a few years and then become a transplant candidate. If there is a history of illegal drug use, that can be changed. Any reversible kidney problems, maybe the patient does not need a kidney transplant because the kidney function will recover. We talked about the uncontrolled mental health issues and history of not taking these medications, because this is something that is taken very seriously from a transplant center. Because if we are giving you the precious gift of a kidney transplant, it is implied that you are going to take good care of it. You're going to do your best to maintain the transplant, and taking your anti-rejection medications, showing up for appointments, getting your labs done periodically is all part of that process. So if there is a documented history, especially that if a patient has lost the kidney transplant from rejection because of not taking their medications, that is going to be a big red flag, unfortunately. It doesn't, make you not a candidate for life, but there will be a lot of scrutiny in terms of, are you taking your medications? Are you showing up for dialysis? So there will be, a lot of evaluation done in terms of people reaching out to your dialysis center. Perhaps they'll be talking to the social worker. I'm sure Samika has heard from transplant centers before, asking, is your patient showing up for dialysis treatments? Are they taking their binders? How much fluid are they gaining between treatments? So these are all very valid questions. And then I think Samika has delved into this a little bit. Once you get on the wait list, there is still stuff that needs to be done, because most of our patients are going to be waiting several years, 3 to 5 years, or shorter or longer, depending upon your center's wait list, depending upon your blood group and other factors. So while you're on the wait list, it is important that you keep the transplant center updated about any new health problems that may come up. Because, for example, maybe everything is going great, you're on the wait list, you're getting offers, and suddenly you fall and break a bone or something, and you have to have surgery. So that is something the transplant center has to know, because at that point, we'll have to make you inactive, because we are not going to be transplanting you while you're recovering from a major orthopedic procedure. It could be something as simple as a flu or a respiratory tract infection, right? We want to know that whether there is something that has changed in your health, because if you are acutely ill, we will not be able to do a transplant at that time. So just keep in touch with the transplant center. Again, your coordinator is your best friend, and call them frequently. Call them and find out what's going on, and that is going to be really, really important. And contact information, Samika has said, please make sure you have a good phone or like an alternative number, so people can contact you, because it is not infrequent that we call a patient for an offer and they don't pick up the phone. And that's a lost opportunity, right? So we want to make sure that you are reachable. And while you're on the wait list, we also want to make sure we are bringing you in every year to make sure that everything is still in order, you're still healthy. So we will require those annual checkups as well. I think that's all I have.
All righty. So thank you both for covering lots of important information on the transplant process and preparation. So real quick, we're now going to move on to our Q&A. Our first question is, and this is for Dr. Urim, it's a two-part question. If a patient's relative wants to be a donor and passes the screening, how long is the wait process to have the transplant? And would the process be sooner than a year?
That's a great question. So usually it depends on the center, and living donor transplants do happen more quickly because there is a person that is obviously healthy and willing to donate. So we want to fast track it. So a lot of times it depends on what we find along the way. We do have to have similar evaluation of the living donor because we want to make sure that the living donors are healthy. And we are considering their health as well and well-being as well. So we have to put the living donors through the same kind of evaluation. So it does take some time, but it can be done pretty quickly. It can be usually a 3 to 6 month process. And sometimes we'll have patients say, this is the right time frame for me. I want to get the transplant done during the summer break because the living donor maybe has vacation or time off available during that time. So we will try to make that happen during that time frame. So it really depends on what the center is available to do, and what the living donor and the recipient are wanting done at that point. So all of that has to come together. But typically, if they do have a living donor, things move fairly quickly, and we can get that all accomplished in a short time frame.
Great, thank you. This next question is for Samika. How can people manage the cost of medications after transplant?
I think what I'm seeing now that a lot of patients actually are doing very well with affording medications. There are just a few medications that may be a little more challenging than others. Sometimes when patients need infusion, that sort of thing. But if you have prescription coverage, I feel like that's something that is going to help you. If you have the opportunity to have two insurances, that's going to help you. So if your spouse has insurance, if you can get a secondary insurance, sometimes depending on your age in the state, sometimes in my state, you can't have a secondary insurance unless you're over 65. But if you have that opportunity, you should do that. And then if you feel like, well, yes, I would love to have two insurances, but I cannot afford that, there are some amazing programs out there. So make sure you talk with your dialysis or transplant social worker about that. But I think just keeping an active insurance, not changing insurance unnecessarily, I feel like you're going to do really well with the cost of medications, surprisingly so.
Great, thank you. Dr. Urim, can someone be listed at more than one transplant center?
Yes, and I think Samika mentioned it briefly during her presentation. And I usually encourage patients to do that actually because it does increase their chances of being transplanted sooner. Because with the current allocation system, there is a circular distribution. So if a kidney patient is listed at a particular center and they are a donor hospital, so they do get priority for being listed at that center. So if you are listed in multiple centers, then you can get offers from various the 250 nautical miles around that donor hospital. So definitely, if you have the ability to dual list, multi-list, and it also depends on your, I think, insurance plan as well, and your ability to travel. I think it is really advantageous to list at more than one center. And we can always share the testing results with other centers. So it's not like they have to do the testing at every place that they go to, but they may have to go and see the providers at that particular center, but we can share the testing results and all that.
Thank you. This question is for Samika. This is another two-part question. Are social workers just involved in the pre-transplant process, and how does their role differ from during the transplant journey?
So social workers are involved in every step of the way. So the pre-transplant process, we want to make sure, like Dr. Urim was talking about, that you have emotional support, you have transportation support, financial support. If there are any history of substance abuse or mental health issues, that's something that is being taken care of. When you're waitlisted, we can become involved. Like if you lose insurance, if something has happened with your caregivers and then you need an updated plan, we will be involved during that part. And then after the transplant, we would see you while you're in the hospital at the time of surgery and after. Life happens. Sometimes you may lose insurance. Your caregiver may not be available anymore. So we will be involved in every step of the way.
Thank you. Another one for you. This person has Medicare and a secondary insurance. If their sister qualifies for a donation, will that person's insurance cover everything for her? So this would be someone willing to donate, and will that the recipient's insurance cover that cost?
Right. The recipient's insurance would cover the cost of evaluation for that donor. So we want to make sure that that's not a barrier for someone who is interested in giving that gift to have any barriers. So that is something that the recipient's insurance would cover. Great question. Thank you for that.
Dr. Urim, how long does a donor have to be without health issues, such as, manage blood pressure, weight, et cetera, before they could donate?
So it again depends on the center. So some centers are a little bit more liberal with their criteria, but most centers will have some sort of a BMI cutoff. So you have to be, like our center, for example, requires our donors to be less than 30 for their BMI. And once they reach that weight, I don't think there is a certain amount of waiting period. Like we don't say, oh, you have to maintain this weight for this period of time. But usually by the time we are doing the evaluation, getting the transplant done, it takes, 3 to 6 months anyway. That's kind of our process, but it depends on the center that's evaluating the donors. And in terms of blood pressure, again, some centers will accept patients if they are on 1 or 2 blood pressure pills at small doses. But if it is more than that, then, they may not accept them as candidates because, again, hypertension, as we know, is a risk factor for kidney disease. So we would be worried that the donor themselves may develop kidney problems down the line. So we don't want to take a kidney from them. So we are also, we have to be good stewards for the donor's health. So we have to look at those factors as well.
Okay. Another question for you, Dr. Urim. Are carriers of an X-linked recessive kidney disease able to donate a kidney?
Again, it depends on whether they are carriers or if they have the full manifestation of the disease and what the disease might be, because there are different penetrations for different kinds of diseases. So it just depends on the specific disease and what their clinical situation is. But that can be a complicated process in trying to determine whether they could be a candidate.
Great.
And there is a lot of discussion. There would be informed consent if there is some risk, and we see this from time to time from patient to an offspring, especially on the pediatric side. We recently had a question, a similar kind of a situation where the child who had an X-linked type of disease and the mother wanted to donate. So, but it ended up actually the genetic test revealed something else. So the mom was able to donate eventually, but that is a question that does come up. And when it is from a parent to a young child, I think it is a very difficult situation. And there is guilt involved, and obviously social workers are able to kind of help with those kind of situations. So it can be a pretty complicated process, but it would require genetic testing, a lot of discussion in terms of what manifestations does the potential donor have, and the implications for their own health, and the ethical considerations of, is it right to take a kidney from someone that may have a kidney disease down the line.
Thank you. One last question. This is for Samika. You had mentioned about, how important it is to have a village in this process. How can caregivers take care of themselves as well during this process?
You need to have more than one caregiver. So that's certainly the first thing. And then that way that they can have some respite time for themselves. I think caregivers need to be a part of the plan, part of the process, so they are knowing how to advocate for themselves too, because they also need to take a break, that sort of thing. But having more than one person is going to be very important, even if that support is in another state. Someone that can physically come and be there and maybe kind of give relief to that primary caregiver, that's going to be really important. And being organized again. So if you have more than one caregiver, maybe they can kind of take turns and that sort of thing, but making sure that they take time for themselves and say what they need. Before I said the patient needs to say what they need, but the caregivers also need to say what they need. There are a lot of great support groups specifically for caregivers also. So that's something that I would encourage everyone to tap into also.
Thank you. Now, as we close out today's session, I'd like to end with asking each of our speakers to share one thing they'd like our attendees to know and one thing to do based on today's conversation. So, Dr. Yerm, let's start with you.
So I think my biggest suggestion is to be your own best advocate. Because I think, nobody else can do that as well as you do. But if you are the kind of person that is not very vocal, find somebody that can do it on your behalf. I think that will make the biggest difference. And there are some patients that will say, oh, I'm sorry, I've been calling your coordinator like too many times. I hope they are not, getting upset but I tell them, be that squeaky wheel, right? You need to call. And that is, the coordinators are there to help you. So the more you call, the more communication you're making, and, we will be pushing your file forward, right? Because otherwise, if we out of sight is out of mind. So be your own advocate, call, follow up on what's happening, find out, and then, do the next step so you can get the process moving along. And there is no substitute for that.
Thank you. Samika?
I love what Dr. Yerm said, and to kind of piggyback off that is just to be prepared. Have a physical transplant notebook, have it divided into sections for each transplant center, especially if you're working with different transplant centers. Keep all the correspondence in there. Know your transplant coordinators for each center, like Dr. Yerm talked about. Make sure you're contacting those coordinators, so you need to know who they are at each center. And make sure all of your information is up to date. Answer your phone, keep your voicemail set up, look at your mail, make sure that there's different communication that you're not missing from MyChart, mail, telephones, that sort of thing.
Thank you. I'd like to thank both of our speakers for sharing their expertise and being part of this engaging discussion. Now, if you did not get your question answered, please be sure to join our next session right after this. Navigating Life After Kidney Transplant, starting shortly at 1 p.m. Eastern Time, or please visit us at kidneyfund.org. Also, as we wrap up the session, you will see a brief survey pop up. Please take a minute to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. Thank you, everyone, and have a great day.